When the coronavirus hit China, the Beijing Health Commission stated that traditional Asian medicine helped improve outcomes by 92%, less symptoms, improving recovery speed, and resulting in fewer deaths. 80% of Chinese use traditional Asian medicine, being acupuncture and herbs, to limit the severity and duration of the coronavirus. 1800 years ago, traditional Asian medicine identified and described the difference between viral and bacterial infections. Western medicine only recently defined a viral or bacterial infection within the last 150 to 400 years, respectively, calling it wind attack due to airborne pathogens carried on the wind, generally differentiating viral as wind cold, bacterial as wind heat, and epidemics as epidemic cold. They understood that one's weaknesses are going to mirror and exacerbate the type of illness one is vulnerable to, defining 1800 years ago that wind cold or viruses for those tending to cold or damp, respectively the aged and obese, will fare worse. And 1800 years ago, they created treatment plans that were created of acupuncture, gua sha, cupping, and herbal medicines that significantly shorten and limit the severity of wind attacks that acupuncturists still use today. I still use these today. The wisdom of traditional Asian medicine is really the preventative principle, which is number one, avoid most illnesses by supporting your righteous qi and balancing your core health. Number two, when ill, treat immediately. Treat at every stage, especially the initial stages. Treating at level one and two is the greatest opportunity to stop the progression and overcome a wind attack. So here's the four levels of wind attack: becoming ill and treating an external pathogen. Number one, prevent the wind attack. Improve your core health and righteous qi, your zheng qi, your immunity. And what you can do is traditional Asian medicine. See an acupuncturist to balance and strengthen your body, to prescribe appropriate herbals to improve your righteous qi. So some formulas that might be used would be Buzhong Yiqi Tong, Yuping Feng San, Huang Qi Ti, Chaga, and Reishi. The first level of wind attack is the Wei Qi level. That's the protective qi, your skin and hair. The symptoms would be like just becoming aware that you're getting sick. There'd be a tiredness, a malaise that you don't usually have, temperature sensitivity. There might possibly be a fever. It could even be a high fever, but it's going to be more fever than chills, then headache, unfocused, sinus congestion, cough, phlegm, dry sore throat. And what you can do is acupuncture. There's a release of the exterior treatment specifically to help people overcome wind attacks. Gua sha, cupping, herbals prescribed are typically Gan Mao Ling, Yin Chao San. Again, you can keep strengthening your immune system to help overcome the attack using Chagan Reishi, Huang Qi Ti. As the pathogen travels deeper into the body, you go to a deeper level. So now we're in the second level, the chi level, the meridian chi from hypodermis to muscle. And this is also the wei qi and the chi level. The symptoms become more extreme, they become more entrenched. You get chills and fever, high fever, the fatigue becomes more extreme, and you might have various symptoms, not all of these, just some of these. So you might have a headache, become unfocused, have sinus congestion, dry sore throat, thirst, nausea, no appetite, poor digestion, bloating. And what you can do again is acupuncture, gua sha, cupping, prescribed herbals may be anything from Renshen Baidusan, Xiao Chai Hu Tong, Da Qing Long Tong. The third level is the yin or nutritive level. So this is into the internal organs of the body now, into the internal organs, into the lungs. The symptoms become the fever may become tidal fever, high or smoldering in the yin, sort of worse at night with insomnia. You might have coughing, dry or wet. There's chest congestion, showing all the damage to the lungs, basically the coughing, the chest congestion. There might be yellow, green, blood tinged, or even white. Phlegm. It could be sticky, hard to expectorate, or easy to expectorate. You have poor breathing, painful breathing, discomfort. You begin to see poor oxygenation of the blood through cyanotic lips. Skin purpura shows the heat, restless, thirst, fatigue. Acupuncture and herbs improves breathing, resolves toxic heat in the lungs, disperses qi. Prescribed herbals might be Ma Xing Shigan Tong, Qingying Tong, Puji Zhao Duyin, Qinghao Baizhi Tong, Huanglian Shang Qingwan. But as things become more serious, now level 4, Zhu level, this is a kind of sepsis. Now it's blood level, heat in the pericardium. The symptoms are fever, high persistent, cyanotic blue lips showing the really poor oxygenation of the blood, severe headache, heat sensations, frigid extremities, gasping, chest pain, restless, irritable, fatigue, fragile, delirium, coma, and death. So now this, somewhere between stage 3 and stage 4, is usually when a person goes to the hospital. And that's what's happening with coronavirus is do integrative emergency medicine, hospitalize acupuncture and herbs. And people in China did do this. So they were hospitalized, but they were using acupuncture, herbs, and they were being treated with Western medicine. Um, Acupuncture and herbs clears toxic heat trapped at yang and blood level, purges fire, opens orifices. So the time between levels depends on the strength of your core health. If you're in poor health, there's going to be a faster progression through the levels. If you're in strong health, there'll be a slower progression. The poorer one's health, the faster an illness travels through the levels and deeper into the core body, becoming entrenched. Often the illness can settle into the lungs, which is level 3 or out of 4 possible levels, quickly and within 3 or 4 days. Once in the lungs, it can take weeks for that person to overcome it. So every illness is a serious battle for someone in poor health. Strong health will show slower progression through the levels. The stronger one's core health, with righteous chi intact, the slower a pathogen will travel between the levels. Sometimes a person doesn't even know they're fighting an illness because they only felt mild fatigue. The opportunity of traditional Asian medicine is a preventative principle. Early and subtle level of illness, you have a great opportunity to limit the deepening and worsening of any wind attack by using acupuncture, herbs, gua sha, and cupping. Contrasting Western to Eastern medicine, Western medicine doesn't have preventative medicines for colds or epidemics, but they do have vaccines. So, vaccines often take a long time to develop. That's one of the problems for the coronavirus right now. Vaccines are often only effective for 67 to 92% of the population, and that's partly because of the antigenic drift of the virus. Over time, the virus tends to degrade. It's also helpful if everyone takes it, which may not happen, and it can also cause other unpleasant side effects. For specifically level 1 and 2, Western medicine doesn't really have anything beyond recommending bed rest, hydration, Tylenol, Advil, and Tylenol and Advil are really only effective for bringing down a fever. Over-the-counter medications that treat the other symptoms are often overly drying, causing deficiency heat, and they often delay recovery and ultimately just mask the symptoms. Whereas traditional Asian medicine, you actually get better very quickly if you're on the right herbs and you're doing the acupuncture you need. Western medicine does not intervene until late in level 3, and that would be with an antibiotic, an antiviral, and or the hospital. Also, a hospital stay is quite expensive, like $20,000. So, in traditional Asian medicine, it is really important to work with a practitioner. Even acupuncturists will see other acupuncturists when they get sick. It's key to work with a traditional Asian medical practitioner when you take herbal formulas because there's nuance within each herbal medication, and only a licensed practitioner is going to know how your specific constitution may react to it. Taking the wrong herbal medication for you, especially when you're seriously ill, is going to cause harm and ultimately delay your healing. Working with a practitioner will help you understand your deficiencies and how to overcome them while strengthening your core health. So, the opportunity and wisdom of traditional Asian medicine really is the preventative principle. And consider this money well spent. Number one, you're getting your core health back, and that's priceless. Number two, paying for one's sickness, even a few days out, is far more expensive in terms of both time, money, and just your emotional wellness than taking care of one's health. Traditional Asian medicine knew how to identify and treat common colds, flus, and epidemics 1800 years ago, and it's still used today. So it's used on the coronavirus. 600 years ago, in contrast, the West, Europeans were burning female herbalists as witches to submit to the expanding Catholic Church. They were saying it was God's will and diagnosing by superstition overall. So, like media tends to give traditional Asian medicine a really hard time. Traditional Asian medicine is not ancient as much as it's advanced medicine. 5,000 years of continuous study, evolution, and use cultivate radiant health for billions of people across the entire Pacific Rim, being China, Japan, and Korea. And that's much advanced to Western medicine's 500 years focusing on trauma recovery from death. Traditional Asian medicine is holistic, it's preventative, and it's focused on life.